Maramana adds that 20 people were arrested yesterday for driving under the influence of alcohol.
Just yesterday, over 20 people have been arrested for driving under the influence of intoxicating of alcohol. Now, these are the type of things that we do not want to see happening. Unfortunately, there are pockets of some of our road users who are not heeding to the calls. We do find people also who are overspeeding, unsafe overtaking. But we keep on telling our road users that road safety is the responsibility of all road users.
China's health department says it's closely monitoring the COVID-19 situation. Several countries have imposed strict COVID-19 regulations on travelers coming from China. New cases have exploded in the East Asia nation after it dropped all COVID-19 related safety protocols. South Africa's health department says it will issue an alert if it becomes necessary to do so. The department has urged the citizens to get booster shots. Now, joining us to look at the threat that China infections pose in South Africa is Professor Tulio de Oliveiral, Director of the Center for Epidemic Response and Innovation at the University of KwaZulu-Natal. Very good evening to you, Professor. Thank you so much for your time. With the new cases exploding in China, how should South Africa be feeling and reacting to this?
Good evening, Paul, and to all your viewers. So basically, South Africa should just wait and see. We do not see a big reason from concern about the cases in China. The reason for that is basic for two main reasons. The first one, the variant that are circulating in China, is still Omicron, and it is a sublineage of Omicron that very similar the one that caused the wave of infection around May, June in South Africa, which was a very small wave of infection with very low mortality in South Africa. And the second reason is because South Africa has a very high population immunity, either from vaccination or from previous infection or hybrid immunity. So at the moment we are in a kind of good situation in South Africa. We didn't see the last wave of the same variant that circulated in China cause havoc in South Africa. And we have a relatively high population immunity, which of course can increase if people that especially like susceptible and with advanced age or comorbidities take serious the offer of our health department and accept a booster in the next few weeks.
You helped lead the multidisciplinary team that discovered the Omicron variant. Is there any indication, as matters stand with China, on the type of variant that's exploded there and what that could possibly mean for South Africa?
Okay, so we are in close collaboration with Chinese colleagues. To be honest, tomorrow we have a big meeting at the World Health Organization. I am part of what we call the expert panel that advises the WHO with 25 leading scientists in the world, and we got all the data from China. So what they have released in the last week, it is hundreds and hundreds of genomes of the variant that's causing the infections in China. And it's the same variant that have been circulated in South Africa since around May, June this year. So because we already had a wave of this variant, so more specific, they are Omicron of a sublineage of Omicron of BA5. BA5 has many child lineages, and all of them in China are still part of the BA5 sublineage, which we also discovered that in South Africa. So at the moment, we are alerted what it means. We are still doing genomic surveillance. To be honest, we should release a report end of next week, as we released last week, and we don't see any unusual variants neither here in South Africa or in China at the moment.
What makes South Africa, different? Because we know that countries like Canada, Australia, France, the US, the UK, and Italy are already acting. They are reinstating travel requirements of a negative COVID-19 test or testing upon arrival. Is it not safe to be safe than sorry?
I don't think so, Paul. And why that is because I think what makes South Africa different is that we are in the other side there. We were on the side that they put a very severe travel ban from South Africa, from both the Beta variant and then from the Omicron. And what we saw by being a country that have been banned from travel around the world is that this did not stop the variant to circulate. So, for example, Omicron went to cause up to 70% of the global infections since the beginning of the pandemic, despite they put a severe travel ban in South Africa. So what we know from the interventions that Europe and United States and Canada put in China, that it is to do a test before you board the plane or when you arrive, and then think on restrict some of the travel. And we know with hindsight in this pandemic that neither of these interventions are effective. So how we see that is more something being guided by basic politics and not science. So today, just before your interview, was a big piece in The Guardian highlighting that the main scientific advisor from Australia advised the government to not put any restriction into China, but they decided to add that. So what we believe is that this restriction of testing, of thinking about curb travel, it is from a scientific point of view inefficient, and it do not stop the virus spreading. And furthermore, the current variants in China are the same ones that we already had in South Africa for a few months.
The health department has also said that there's no immediate plan to impose these travel restrictions. What will be the most effective intervention? Because, of course, looking back at how harsh and how severe the height of COVID-19 was in South Africa, one would not want to go backwards.
Yes, one do not want to go backwards, but we can learn from the recent past. So, for example, once we discovered the Omicron variant, and that was end of last year, despite the world panicking, South Africa had a smaller wave of hospitalization and deaths, and that was around November, December last year. We had, just before the winter, around May, June this year, another wave of infection with the same variant that's currently circulating in China, and many people did not even notice in our April, May, June wave where we didn't have any restriction and we didn't have an increase in hospitalization and deaths. So that's why on the scientific front, we are kind of confident that if introductions happen in South Africa from China, which is likely to be the same variant that has circulated in South Africa, at the moment is unlikely to cause a big wave of infection, hospitalization, and death. But for that, to make sure, that's why we continue doing genomic surveillance. And every week, our teams, we have 9 big labs in South Africa, including 2 of the labs that I direct in Stellenbosch University and UKZN, plus the NICD, that are working to make sure that we always know which variants are circulating in South Africa. And at the moment, we don't see anything unusual. It's just Omicron and the similar one that caused the last wave in around April, May, and June.
Yeah. As you say that there's no need to panic, I mean, what assurance do you think citizens should perhaps look to as the infections are rising in China, and perhaps people may be worried about their own personal health? What can be done?
So for people that worry about their own personal health, the most suggested solution, it is to they see if they are to receive a booster. What it means, normally after your vaccination, you're going to get an SMS from the health department saying if you are in time to receive a booster vaccine. So, for example, I got 4 doses of the vaccines, and as everyone in my lab, So, and why that? Because we deal a lot with COVID samples, and even the people that got infected in my lab, none of them got sick because they had very high level of antibodies from vaccination. So anyone that have an elderly parent or have some strong comorbidities such as diabetes, hypertension, or obesity, and are very behind on the vaccination, if they are worried about the situation in China, the best suggestion is to go and get a booster.
And what about those who may have had two vaccine doses, or perhaps the young people? I remember quite a while ago that were being urged to have one shot and then told to come back for a second. How does that bode in terms of what needs to happen with those cases?
So in South Africa, we have a very, very high immunity level, population immunity. Yeah? We estimate from many different surveys that up to 95% of people in South Africa has a different level of immunity, either from vaccination or from previous infection, or for something that we call hybrid immunity, being vaccinated and being infected. And this one is normally long-lasting. Yeah? So at the moment, at a population level in South Africa, we are in a good immunity landscape, yeah? And that's why our suggestion is not to everyone to go and get a booster, but only people that are more susceptible to develop disease. This means advanced age, yeah, or with serious comorbidity, yeah, and that's what we can do. Of course, that South Africa, we also need to go back to full economic activity, and we have been for a year. I believe that this summer season and the tourist season has been a success in South Africa, and we need to go back to normal, and we need to kick back our economy. Yeah? So I don't forecast any kind of restriction coming to South Africa when infections are so low, hospitalization is very low, excess deaths, and no unusual variants have been emergent in China.
Very well. Thank you so much for that. Let's leave it there. Professor Tulio de Oliveiral from the University of KwaZulu-Natal saying there's no need to panic as the cases in China of COVID-19 continue to rise.